and welcome to Hopkins at Home. I'm Dr. Rachel Salas. I'm a sleep neurologist at Johns Hopkins, and partnering with me today is Dr. Charlene Gamaldo, also a sleep neurologist at Johns Hopkins at our Johns Hopkins Center for Sleep. Today we're going to be talking about sleep health, wellness, and kind of what are some of the things that we've been doing during the pandemic. And we'll explore some kind of lessons learned and where we're going to be moving in the near future. So with that, I'll get started. All right.
Okay, and we will give you a little outline of our journey today. We know, just based on our experience as sleep providers and being very popular at dinner parties and what have you, that there may be many questions out there. So please feel free to use the chat option to type in your questions. We'll take the opportunity to answer those at the end and with about 15 minutes. We may not get to all of them, but we will provide you several resources throughout the talk to get those questions answered and hopefully to bump up your sleep IQ. So with that in mind, we will give you a little bit of a sleep 101 to talk about the basics of sleep, then talk about how things have evolved for us in this pandemic in terms of how we deliver sleep services, how you may want to think about sleep in terms of your wellness, and how we've been able to adapt. We think much of this has been helpful for us as providers, but we also think it will be very helpful for our patients as well. And we'll talk about education because just as we are teachers, we're also all students. And we'll talk to you about how we continue to stay abreast of the latest about sleep and how we try to provide that for our community and our patients. So next one. Okay, so I sort of alluded to this in the last slide, but what we hope that you'll get from this talk is that sleep remains an incredibly dynamic discipline. We've only recognized sleep as an actual medical specialty since the 70s, and for that reason, it's dynamic. We're constantly learning and we're constantly evolving. But with that also comes the ability to be adaptive to what's going on. And what you'll see here is a really nice figure from the Center for Creative Leadership about how you can think about sleep in terms of resilience and how we've actually used that as well in our practices. Another thing that is also a key theme that we want to bring out is in this time of the pandemic, in this time of working in a specialty that's constantly evolving, we've really needed to lean on strengths and strength psychology to make sure that we're always bringing our best foot forward and using the strength of our staff, the strength of our different members to think about how we can constantly adapt to these changes. And as you can see, Rachel, Dr. Salas and I have both become, as a result, certified strengths coaches and have recognized that leaning into your strengths and using strength psychology actually helps you to be a happier person, a more energetic person, a more rested person, and helps to mitigate the things such as stress, anger, worry, and sadness that would go against that. We have adapted that for many of the things we do professionally and personally. So with that backdrop in mind, let's go through some sleep 101 and sleep basics. Take it over, Rachel.
So the first thing is that sleep is a basic human need. We all need it. We all do it. Most of us don't do it that well. But as you can see here, there are physiological changes that occur in the brain. And those are what we can monitor. And these can be disrupted if your sleep is not where it needs to be. So the average typical human being can need anywhere from 7 to 9 hours. I know everyone out there believes they're special and only needs 5 hours of sleep. That's not true. 7 to 9 is typical. There are some short sleepers, there are some long sleepers out there, but most of us are between 7 to 9. According to the National Sleep Foundation, they do an annual study, and one of their studies, they surveyed several Americans and asked them, how much sleep do you think you get? And this was subjective. So they said, on average, I get 7 hours and 36 minutes. That's what the group said. However, even though they're getting enough sleep, right, only 35% of those individuals actually report that their sleep was of good quality. So what's going on there, huh? Well, some of you may be surprised to know that there are actually 80 different types of sleep disorders. These are diagnosed like sleep disorders. They're in a textbook. We see it. There's over 80 of them. $80 billion a year are thought to be attributed to the consequences of poor sleep deprivation, whether that's poor productivity at work, whether that's car accidents, or even bigger accidents with airplanes and trains, for example. 80 million Americans, 80 million, actually suffer from the consequences of poor sleep. So 80 million. 60 million Americans actually meet the diagnostic criteria for a sleep disorder. But guess what? Only 40 million are diagnosed and therefore treated. So this affects us all because people are out there sleep deprived for one reason or another. Maybe it's they have an undiagnosed, untreated sleep disorder, and we're all on the roads and interacting with these people. In fact, according to the CDC, 36% of Americans report feeling drowsy while driving in the last month. And as you get older, with like a lot of things, right? But sleep becomes more of an issue. And in fact, 50% of individuals over the age of 65 meet the diagnostic criteria for a sleep disorder. Many of those individuals are not diagnosed and therefore not treated. So what happens if you get poor sleep, whether you don't get enough or you have an undiagnosed, untreated sleep disorder? Well, you could get forgetful, you'll have reduced performance, decreased attention and reaction time. But no, there's more. You also get a decreased libido. I know people are always interested about that. You'll look older and you'll gain weight. And guess what? If you have a pain syndrome, you have some kind of chronic pain, you're actually going to feel it more. So all good things, right? And then lastly, it can impact your behavior. You can engage in risky behaviors. You might, do things that you probably wouldn't do. And we've all been grouchy from not getting enough sleep, but chronic poor sleep can cause mood issues. There's strong associations there with decreased mood. So Charlene and I could finish right here and say, just go get some sleep. It's all good. That's all you got to do. Just get some sleep. Well, it's not that easy, right? So we're here to kind of tell you there are some strategies that you can do, and we're going to hit it from multiple areas. Okay. But first we got to, give you the background. So I want to start off by saying that you're not hallucinating. I like to pop up in cartoon form during my presentations just to, give a little oof to what I'm saying. If you get less than 6 hours of sleep, guess what? You have an increased risk of 21% of getting obesity. Who's interested in that? Also, 22% increased risk for stroke, 25% risk for diabetes, and 35% increase in coronary artery disease. Now, these are all backed by not one study, but several different studies. So we know sleep deprivation, again, whether it's because you're not getting enough sleep or you have an undiagnosed, untreated sleep disorder, these are some of the risks. These are the top 5 sleep disorders. Some of you might be saying, what? Chronic insufficient sleep? How is that a sleep disorder? Well, I think that proves the point, how we all kind of push sleep to the side. Some of us want it, we just can't do it, but we're not necessarily, doing the best strategies that we can to address our sleep deprivation. That's followed by insomnia, circadian sleep-wake disorders, which are an issue particularly right now, and then sleep apnea and restless leg syndrome. We're not going to get into the sleep disorders. That's another conversation. And Dr. Gamaldo and myself, we have lots of materials out there that can educate on that. But let me turn it back to Dr. Gamaldo.
So Dr. Salas just gave you there a rundown of how it's important to get good sleep quantity. And of course, superimposed on that, you want to get good sleep quality. And some of those sleep disorders that she mentioned can impact both of those. Sleep is very complicated, and the reasons that one individual may manifest insomnia may be slightly different than another. And that's why we always have to think about the particular patient, the perspective, and you really need a whole bunch of different specialties to weigh in. And that's why we're really proud to have a sleep center that represents quite a few of the different specialties of sleep. This is our fabulous group that represents not only adult and pediatric specialists, sleep specialists, but we have pulmonologists, neurologists, psychologists, and even sleep anesthesiologists. So we have a fantastic group. We were rocking and rolling. As you can see, Dr. Salas there literally rolling with her iPad, interviewing the patient in our state-of-the-art sleep center, and we were making it all happen. Everything was going well. And then COVID hit. And so, as I mentioned, we'll go back to the resilience, the adaptability that we've tried to incorporate, and hopefully we'll give you insight as to how you can do that too. And we had to quickly think about what we can do to provide these really essential services to patients. If you don't get your sleep right, you're potentially going to have your coronary artery disease. The risk of that be higher, or it's going to be harder to manage. The risk of stroke is going to be higher. That's even more essential, especially in an era of pandemic where we already know people were kind of concerned to even go to the emergency room or to a doctor. So as that happened, sleep hit a whole new level of attention. We were already quite popular on the morning shows, etc. But we hit the circuit. And as you can see, Dr. Salas was interviewed here by Neurology Today, which is one of our premier publications for the American Academy of Neurology for patients, and even interviewed by the New York Times and other well-circulated publications.
Yeah, and what's interesting is a couple things. One is, our patients that had issues with sleep already, it got worse for the most part. And even people that didn't have issues with insomnia, they started having problems with insomnia, circadian rhythm issues. You're staying at home, you're not on a schedule, you're not getting sunlight, everybody's isolated, your mood has changed. And so we coined the term COVID-somnia, which basically is like sleep disruption because of COVID. And so what you had is people, worrying about losing their job, getting sick, their loved ones getting sick, like not being able to work and support the family. So just a lot of concerns and issues. But that wasn't it. It continued. 2020 has not been a great year. And then we had social unrest and then all the politics happening. So there's just a tremendous amount of stress. And so what happened is mental health has become a major issue. There's now more prescriptions, as high as up to beyond 35% increase in new prescriptions for mental health and sleep. And more people, I can tell you, we quickly turned over overnight, essentially to a telemedicine clinic, and anxiety level, which obviously has impacts on sleep, has just tremendously worsened. So we'll transition here to kind of what we're doing, and I'm going to hand it back to Charlene.
So what we're doing, we already had a lot of patients with sleep needs, and then we brought in a whole new crop of patients as a result of the pandemic. But, with adversity, we had to figure out how we can help our patients. And this is our fabulous team. This includes our support staff, who we could not do the things that we do for our patients in our community without them. And we quickly realized, telemedicine and sleep care can actually be a perfect team. So we immediately, within 2 weeks, converted all of our visits, our clinical visits, to a telemedicine platform. And as you can see here, this is just some of our stars of the team providing that. Next slide. The other aspect of it is sometimes you have to think in these difficult times, not only what have we lost and how do we adapt to it, but also how can we potentially gain in terms of what we can provide for insight and advice for our patients. So doing telemedicine did provide an interesting window for us to get a sense of the patient's sleep environment. I always thought it was kind of interesting when I'd have a patient call in for their telemedicine appointment at 2 p.m. and they're still in bed. So that tells me something about like what's going on with their sleep routine. It also is a time for us to benefit from having multiple members of their family, multiple members of their support to actually dial in and be part of the visit with us. So that's from that aspect, it has actually been a plus, and we really try to optimize that as much as possible. The other thing we were already doing was that the landscape was starting to push more towards ambulatory sleep diagnostics. So we were really poised from that standpoint to provide that service. As you can see, we were even in the midst of, we had an ambulatory home sleep apnea test, the one on the left, but we were quickly trying to find alternative FDA approved devices that were even less invasive. And we have the one that's in the middle, the WatchPat, that is literally one that uses arterial tone. And it's as simple as a wristwatch and a pulse ox. So we were able to bring that online and do that more robustly. And then finally, we even have a sleep EEG ambulatory device that can look at people's sleep waves and their brain waves in the comfort of their home, in their natural environment. We already had that. How could we adapt that for COVID? Well, we said we need to ramp that up to a whole new level. So we took that curbside and made that a drive-up process, minimize the contact within the building, certainly, because we know that's an issue, and minimize contact in terms of the different staff, and could provide that. That is now rocking and rolling, and has been an incredible asset for us to serve our patients.
Yeah, thanks, Charlene. And so even before COVID hit, there was initiatives out there about precision medicine. And precision medicine is a fancy term for, all these studies that we can now do for individuals. So the person in front of us look at their biological data and really customize a treatment strategy. Our sleep center, has been looked at as a role model for kind of, taking this approach. And we're going to share just some of the strategies that we've been kind of doing even before COVID, but have been able to continue. So precision medicine, as I said, is basically the study of individuals' biological characteristics and specimens. And there's all different types of way to do that. Genomics, metabolomics, pharmacogenomics, you can keep going with that. And so that was something important, not only to us, but really for Johns Hopkins. Really, it's actually in our strategic priorities, and we already have a few precision centers within Hopkins as we are here presently. But in the field of sleep medicine, not much has been really done. There's been some work in precision looking at sleep apnea, particularly obstructive sleep apnea, and then also looking at circadian rhythms. Some people might respond when taking a certain medication at a certain time of day. Some people might respond to CPAP therapy, for instance, when you have sleep apnea, while others might not. I mean, they might not physically respond, but we still, treat them to reduce the risks of sleep apnea. So there had been some work already in it, but certainly not much, but it's definitely increasing. So for us, the reason you want to do precision medicine is because you want the result of personalized medicine, right? So in the past, we've always been trained to kind of use evidence-based medicine to look at clinical trials, find out what those trials show, and then you kind of, have patients with whatever diagnosis, and you say, okay, this is the best treatment. Doesn't matter who you are, let's just use that treatment because we have clinical trials to show us that works. Turns out that not everybody will respond, and not most of the clinical trials out there really just looked at, one type of patient population. It wasn't very diverse. So you don't really know who's going to benefit one way in a positive way and who's going to have a lot of side effects and negative impact. So that's really the goal of precision medicine, is to be more personalized, to use evidence-based medicine to treat the person in front of you. However, you can have the best treatment strategy, but if the person in front of you, based on their values, maybe their past experiences, their beliefs, their financial resources, all these other things come into play. And so we have to be able to connect with our patient. And so with electronic medical records, that's been a little difficult. So Dr. Roy Ziegelstein, who's a cardiologist by trade, he's also the Vice Dean of Education at Johns Hopkins, coined the term personomics, which basically means to get to know the person in front of you, to really understand and connect with the patient so that you can meet their goals. So personomics, again, kind of brings in everything about the patient. There's other things that aren't necessarily on here, but it's really trying to develop that relationship between the clinician and the patient so that we together can come up with the best treatment strategy for that particular patient, which may be different from the next patient who has the same diagnosis. So one of the easy things that we've been doing and has really been informative for us on the clinician side was asking our patients, what are your sleep goals? Like, what do you want to get better? Often we find that our sleep goals as the provider are a lot higher than what our patients a lot of times want. So sometimes it's kind of sharing the goals that we have for each other, for what the patient wants, and then for what we want for the patient in terms of their sleep, and getting on the same page. And I think that this is an easy step that has been really helpful for us. We understand that sleep is not only an issue for, obviously, in our center. Sleep is something that transcends all medical disciplines. And our colleagues have also reached out for this. So we developed an app called My Sleep Script that is basically a clinical tool which patients could fill out, even before coming into their visit. They could fill it out in the waiting room of a non-sleep clinic, like in cardiology, for example. And what it does is it alerts the clinician, say, hey, this patient actually has a lot of worry or a concern, a mild concern or a major concern for a particular sleep disorder. It doesn't diagnose, it just incorporates risk factors, symptoms, and it's a clinical tool that we've already been using. And it also provides behavioral strategies so that the patient can get some homework so they can be part of the sleep treatment there. We have a couple of papers and a couple of others that are under review looking at the app, that it's been used in other clinics and it's been well received. And it's actually helping to identify patients that probably, either one, didn't have time to talk about their sleep disorder with their other, physician, or just didn't realize they had, issues with their sleep. Our app also incorporates, like that patient homework I was talking about, but we've also began to implement other, non-traditional, non-medication strategies like yoga positions. I'm often giving my patients a bedtime and awakening time, but we've kind of outstepped, the tradition and really are bringing in mindfulness, meditation. We have a customized meditation that we worked for with an integrative medicine specialist, and even just getting outside, especially right now with COVID, when people are cooped up and not getting that routine and they're not getting that sunlight exposure. And that's a problem. It's a big problem, can lead to insomnia. On top of it, for our patients with obstructive sleep apnea, for example, well, we get information. If you look here on the left, there's some data that we get from their CPAP device. So the machine that's connected to a rubber hose takes regular air from the room. It's not oxygen. So it's not breathing for the patient. It's not giving oxygen. But this comes back and you can see this patient, he got a gold star because he's using it all the time. He's improved, feels better, and it's working. I can look at that data. But now these machines actually have their own app. So my patient on the right can get his data in the morning and get, kind of see, are there any issues? Oh, I see some problems here. Let me contact my doctor, or let me contact the respiratory therapist at the sleep center and see what's happening here. So there's a lot more data. There's a lot more information that not only we are getting as the clinical team, but that our patients are getting, and really putting them in the driver's seat to be involved in their healthcare and being proactive. Again, personalized, right? So with that, I'm going to transition back to Dr. Gamaldo.
Okay, so we want to synthesize some of these tips and our journey, and go back to you, turn this back to you. What can you do? What can you do to be a better sleeper? Well, first and foremost, we got to continue to go back to making sleep a priority. As we mentioned with those stats at the very beginning, sleep is a basic physiologic need. It is actually no different than the drive and need to breathe, to drink, to eat. And if you don't make it a priority, eventually it can be, first and foremost, the reason for poor health. So you have to see it as a priority, just as it's a priority to breathe and drink and hydrate. Once you've established that, I cannot compromise my sleep, then you take the tips that we talked about in terms of checking your own sleep habits, and thinking about what is optimal for you for your sleep. Because guess what? What may be optimal for someone down the street, what may be optimal for somebody on Google, may not be the ideal setting for you. Maybe you need not 7.5 to 8.5. You may be a 9-hour sleeper. You need to figure that out. Everybody's circadian window may be slightly different. Are you 11 to 7 person? Or are you more like a midnight to 8 a.m. person? Those are the types of things that you need to figure out. What are the sleep habits that are best for you? What are the routines that are best for you to make it conducive for you to naturally transition into the tranquility of sleep and wake up ideally without an alarm clock in the morning, feeling rested and restored and ready to start your day. Once you've figured that out, you got to be consistent. That can't be something I just do Monday, Wednesday, Friday, right? Or on holidays. This is something that has to be consistent all the time. Think about this. It's great to get a gym membership, but if you don't go to the gym and you actually don't do the routine, that gym membership is not going to help you to be a healthier person. You have to be consistent. You have to take ownership and prioritize this as something for your overall health. We are always trying to provide little tips and trades to help people to become the best sleepers they can be. This is even one that's relatively fresh off the press from Dr. Salas, that's talking about new ways to deal with your sleep problems. I think this came out through the Howard County Hospital site, and even down to how you wind down. Hopefully you're not doing it with a nightcap of wine. And we can always get into in the question section if it comes up why that is. But that's really important. Keep up your sleep IQ. Keep trying to stay abreast of what's the latest and greatest in terms of sleep health benefits and routine, just as we're doing. We're all teachers and students here. The other thing is we try to provide some of this information through reputable sites. We teamed up with Under Armour a few years ago and provide some information there through MyFitnessPal. And I am Dr. G for folks if they find us through that avenue. But that's another way to do it. And again, trying to provide this information through reputable sources. Another thing that, as we talk about Under Armour and exercise and physical exercise, which is definitely important, not just for your health, but for sleep, is I want to talk about a segue to another important exercise. And I mean that more figuratively. So folks may have learned about this and heard about this, about journaling as a way to kind of purge your thoughts, to kind of cleanse what may be worrying you so that you can hopefully transition into sleep. That is a good idea, but we want to challenge that a little bit. We want you to be intentional about how you journal. And if you journal right before sleep, we want you to think about the last thing to do in terms of that exercise is write at least 3 things that you are happy about, that you feel grateful about, or that you're thankful about, especially during these extremely challenging times, because that helps to ground you, to hopefully say, even despite everything going on, I feel thankful about X, Y, and Z. Again, that's what your brain needs in order to sort of get into sort of the wind down of sleep. Certainly, this is a critical time where there is much that people are worrying about, thinking about, and we want that time to purge, to do that with a journal. But think about doing that in the morning, or if you really need to do it at night, do that first, but then always end on this positive note. So that's a new figurative exercise that we are introducing to a lot of our patients, and they found it to be helpful.
Yeah, I mean, incorporating it into part of your bedtime routine.
The other aspect, as I mentioned too, is these are really hard times, but it can be helpful to always think about not just what we've lost and how we're trying to compensate for it, but what we may have gained from this, and may have been the fact that there's time to reach out to friends and loved ones when life was very, very, very busy and we were all on the treadmill. We weren't able to do some of those things that can help to ground us, to to have a little bit of peace and comfort during these difficult times. And I'll even turn it to the fact of sleep. So this was an interesting article from Forbes. A paper was put out in NIH, and there actually have been other papers supporting this notion that in this time of COVID, although folks' sleep quality has been compromised in many instances, there are other people who have found their sleep has actually improved. And it's from the standpoint of working, whether it's the variables of now that they're working from home, now they have a little more control over their schedule and their environment, that they're actually sleeping, having longer sleep duration, they're having those opportunities and they're taking advantage of it. And I can even say that I personally have seen patients who they used to commute to DC for a 4-hour commute. They got that time back and they actually used that to prioritize their sleep.
All right. So just like everything else, turns out that the studies show that if clinicians, so like in our case, physicians, if they eat right, exercise, don't smoke, practice good behaviors, then they're more likely to counsel and talk to their patients about this thing. And the same goes for sleep. At least that's what we believe. We believe that if our colleagues in other specialties, know more about sleep and are enhancing their own sleep, that they're more likely going to make the time to talk to their patients that are there for, in other clinics about their sleep and how that can impact them. But it turns out that, at least in medical school, that medical students don't get that much training in sleep. I mean, the average is anywhere from 0 to like 4 hours for the whole 4 years of medical school. And that's mostly in the setting of like a lecture, like, me or Charlene giving a talk on sleep. But that's changing. And Charlene and myself have worked with other colleagues that are medical educators at the national level. And we've put together consensus statements. And in this case, we put in recommendations for how to implement sleep education for all medical students, so the future physicians. And, we're trying to extend that beyond medical school and look, even with nursing and pharmacists and physical and occupational therapists. So we are passionate about this, and we have done work in that realm. We've also teamed up with our media center at Johns Hopkins, because we know that not only our patients, but patients of, other specialties within Hopkins, but just the people, right? Everybody out there. It's just like dental hygiene. We can all do better, right? But you might have questions. And if you just Google like your questions about sleep, we don't know if you're actually being taken to reputable sites where the information's been reviewed. So we actually have a pretty good site that really can answer a lot of your quick questions. They're like, most of them are anywhere from like 1 to 2 minute read. And we have like these cool infographics that you might want to take a look at. And we'll talk about anything from like melatonin all the way to like menopause and sleep and how that impacts sleep. So I highly recommend that you check it out. It's reviewed and it's been updated. And now I noticed that our media team has been doing like little videos. So there's no reason why not to check this out, especially if you have some questions on, do I have a sleep disorder or how can I improve my sleep?
Just don't check it out right before you go to bed. No screen time.
Yes, disconnect. So I mentioned the one app that we did that's out there, and that one's more of a clinical tool, but we have other apps that really are aimed at education. And we worked on some here on the left to educate our colleagues in other specialties, our students from all health professions, and researchers that are that are looking at sleep. But there is an app that we put together called Sleep Matters here on the right, or my right. And that's available on iTunes for free. And it just kind of gives you a quick sense of, what are some of the common sleep disorders. If they're like 5 to 10 minute, quick little lectures. And that's where you'll get to see Dr. Gamaldo and myself in cartoon form. So if you're interested, check that out. It's free. The other thing we've been doing is working with the American Academy of Neurology, and we put together like these bite-sized videos. We call them neurobites because we're neurologists and everything has to be neuro-related. But they're, meant to be like these 2 to 8 minute quick little some of them are interactive. We try to make ours pretty interactive, but they're quick little videos to kind of just give you some insight on a particular topic. So we have this one is more general about sleep. But then we have one coming out on insomnia. And then for those of you that are interested in other neurological disorders like migraine, Parkinson's, all of these other things. And we have a lot of little videos. They're really kind of targeted at clinicians, but I know that some individuals are more interested in learning a little bit more. You can have access to many of these. Many of them actually are on YouTube.
Rachel, do you want to say anything about the neurobites and the format and what we've sort of learned as adult?
Yeah. So basically at this point, I'm wondering if anyone knows the attention span of a goldfish. I didn't, but now I know that the attention span of a goldfish is 8 seconds. And guess what? People have their phones, their like laptops, ting, ting, ting. It's like constant notifications that the average human has an attention span less than a goldfish now. So I know that, I'm sure most people aren't shocked about that. So people are not looking for these long, and here we are talking to you for like an hour.
We're pushing the envelope with this 45-minute talk, but
Yeah. So we're trying to get away from that. And so that neurobite is kind of, news you can use kind of in little snippets. So you stay kind of engaged. And even if you get distracted here and there, you're still kind of, you're hearing it, you're seeing it, it's moving around, and hopefully it will grab your attention. But because, sleep is obviously, we all do it. Most of us don't do it well. There's always questions like, how can I be better? If you're an athlete, how can I have my performance be better? How can I enhance my sleep? If you want to be more productive at work, if you're at risk for memory disorders like dementia and things like that, people are really more self-aware when it comes to their sleep. So I'm happy about that. There's more sleep awareness, but there's just so much to be discussed and shared. And Dr. Gamaldo and myself are doing our very best to get all the information out there in different ways and different groups. And so what's going to be coming soon is we are going to be launching a podcast. Everyone has a podcast. We thought, why don't we have a podcast? We should do this. So Hopkins Sleep Script podcast will be coming very soon. We're working on our launch. I'm hoping in the next month or two that we'll do that. And Dr. Gamaldo and myself have tag team, and we brought up under the name of MD Sleep Talkers. So more to come on that. And we've set up a Twitter account. It's very new. So if you want to kind of be in the know when our launch happens, follow us on Twitter. All right. So more to come on that. And again, our podcast is not going to be a drawn out thing. It's really going to be these short little snippets. And we'll talk about sleep and anything related to sleep in kind of these small amounts of time. And it'll be very conversational. It'll hopefully be news you can use. So for those of you that are like, okay, these doctors here, they're talking about personalized medicine and precision medicine. But there's all these, I Googled this, I know how to improve my sleep hygiene. And so, yes, we know there's lots of things, there's information at your fingertips, and we're trying to obviously prepare that information for you as well, right? But the truth comes in that when you work with a sleep specialist, like one of us, right, then we can get a little bit more personalized and customized. The problem is it's very difficult to do that in a clinical setting. So there are times, many times actually, when patients, they need to be patients, right? They have to come see us in clinic because we're concerned they might have obstructive sleep apnea, which is a major sleep disorder. They even put that as a cause of death on death certificates now. That has a lot of risk, increased risk for heart attack, stroke, memory problems, 5 times more likely to get in a car accident. So those kinds of patients, we can do a lot on the medical side. However, there are people out there that really don't have crazy, bad sleep. I mean, they're sleeping okay, but again, it could probably be enhanced. So it's possible. And if there's enough interest, we could potentially, team up to do a master class. So I don't know if people are interested in going to school. Maybe we could do this virtually, do a little master class and talk about your sleep and make it more personalized. We won't go down the road on the medical side, but certainly personalize it a little bit more so that you can have an optimal bedtime routine. You can ask your questions, and it can be more customized. Or perhaps could we consider doing some type of sleep coach? Charlene mentioned earlier that we're strengths certified coaches. I know I've been using strengths in my clinical practice to better connect and form relationships with my patient, to better understand them. And so kind of coming up with these customized approaches, again, are kind of like an extension of the medical care that we can provide for people. But certainly not everybody, might have a sleep disorder, but they're just trying to enhance that. So there may be some opportunities to come. And if you're interested in that, please let us know, and because if you're interested, then maybe we can put something together. And if you're not, well, then maybe eventually we'll see you in clinic, right? So with that, I'm going to end. I'll have Dr. Gamaldo take us home, and then we'll have some time for a lot of questions.
So our final slide is, of course, to sleep well. If you take anything from this, sleep well. We can't do any of this without, of course, acknowledging the members of our team. And this goes across the Hopkins family. Our neurodevelopment office has been fantastic. Hopkins at Home team who put this production together for us to broadcast to you, all of you, education about sleep. We also want to thank of course, our JH Center for Sleep team, our providers, our staff. It's fantastic. Again, it takes a village to provide good sleep health, and we have to give them their kudos. As you can see, we have, throughout the years, and we continue to try to provide innovative new initiatives, approaches, educational products. And this cannot happen without much credit and shout outs to the friends and contributors of the JH Center for Sleep, who have been phenomenal. And we just cannot say how grateful we are. Some of them are listening today, so I want to thank all of you for that. And if there are folks out there who find any of this interesting and would like to be part of the Friends of JH Center for Sleep, or to potentially contribute to any of these current or future initiatives, please feel free to reach out to the neurodevelopment office. And after all of that, we also just want to thank you for tuning in, for sleep to be a priority. You've already demonstrated your at least one step towards that by tuning in, getting this education, and getting this awareness. And we really appreciate that. We really appreciate your time, considering what we know about the goldfish and its attention span. So we thank you for your attention. And I think we're ready to take some questions.
Yeah, and before we do that, I have our Twitter and Instagram accounts. Again, we're just kind of getting started, but I do on Rachel Salas, MD, I do post, things about sleep. I also do a lot of medical education. So if you're okay with that, then follow me there. But we're going to be ramping up some of our other Twitter and really kind of give you snippets of information, and then also advertise when we get our podcast up and running. So our first question is from Joanne. Beyond sleep hygiene, please share tips on how to stay asleep and prevent mid-cycle awakenings in order to access REM sleep. Charlene, do you want to start with that one?
Okay, so so first of all, a couple of things to know is to help stay asleep. It's also about the whole process and the routine of as you get prepared for sleep. So a few things you definitely want to do. It's the screen time, especially in this time of COVID. We're more attached to our screens. We're watching news late at night. We may be streaming Netflix like it's going out of style. You really got to cut that off about an hour beforehand. And it's because that melatonin needs to be online in your body to help not just set the stage to initiate sleep, but also to help consolidate it. The other thing that is important to know is to know sort of the normative range for things. So as we age, our ability to consolidate sleep is going to be reduced. That's not necessarily representative of there is a sleep disorder. That's just representative of how our brain is constantly still developing and evolving as we age. What is important to know, though, is that if you wake up, you should be able to fall back asleep within 30 minutes. If you're not able to do that, it could be part and parcel of more than one sleep disorder, and it's time to potentially think about having that formally addressed. In terms of assessing REM sleep, Joanne, I just wanted to make that point too. So a lot of folks associate REM sleep with dreaming, but just because you may not recognize or that you dreamed the night before doesn't mean it necessarily didn't happen. The only time we really remember our dreams is if we potentially wake up in the middle of the process. So all of the stages of sleep, it turns out, including REM sleep, but also stages of non-REM sleep, are all important for us to get our restorative sleep and the best sleep that we can get, and start out knowing sort of what is expected in terms of a little bit of sleep consolidation and how you can do your best from a behavioral standpoint to set the stage to do it smoothly. Once that you've tapped out on that, and it doesn't seem to be working, it's time to make an appointment and chat with someone to go further.
Yeah, and that's where we have one of our colleagues, sleep behavioral psychologist. That's where it's very important to really kind of understand who the individual is and what issues they might have occurring. Perhaps you have something in your sleep environment that's causing issues and causing awakenings. Are you changing your bed sheets regularly? Because if not, allergens can not only build in the sheets or pillows, but in the mattresses. There may be things in the environment that you're not aware of that could be causing these like disruptions in your sleep. So I would say that if you've tried some strategies and things aren't working, it's probably time to talk to your clinician and perhaps even come see one of us at the sleep center to really kind of dig a little deeper and utilize some of the tools that Dr. Gamaldo talked about earlier, looking at your EEG at home, kind of getting more insight if something else is going on. Now, we have a question regarding, the segmented sleep. There's a lot of work coming out of Virginia Tech, like looking at sleep, which is very fascinating. The idea of humans being two-part sleepers, and then with the invention of the light bulb and the Industrial Revolution, we were kind of forced to put our sleep segments together so that we can kind of, consolidate. So there is some hypothesis out there that insomnia, so the people that wake up in the middle of the night and can't go back to sleep, that they're actually waking up because that's the natural human tendency to do so. So the idea there was that, humans would go do a lot of hardcore labor outside, come home, have a meal, and then go down for a heavy sleep. That was the first part of sleep. And then they'd wake up around midnight or between midnight and 2, for example, and then they would do kind of like household chores, feed their animals, meditate, do whatever. And then they would go back to sleep a little later for their second part of sleep. So there's a lot of interesting information out there. I think that for me, we don't, first of all, we don't have much, support about like segment sleepers, but certainly there are people out there that do really well and they have their sleep-wake schedule kind of timed. I mean, if you talk to, and there's books about this, like successful people, like they go to bed at exactly 10:36 p.m. and they wake up exactly without the alarm at 6:05, And so people are now really customizing and really like studying and experimenting at home with timing of their sleep-wake schedule. And we have I know I've been working, I'm sure Dr. Gamaldo agrees as well, that this is some of that personalized approach that we're kind of taking. But there are some limitations that we can do in the clinical setting just because, you're seeing a lot of different patients and ordering tests. But I think there is some opportunity there. And I think, hopefully to answer the question about being a segmented sleeper, I think it's the question was, I am a segmented sleeper. Can I take a 30-year, or can I break a 30-year pattern? I think that sometimes we can try to reset, and we often work with our patients in the clinic, but it's really, there's so many factors involved. So, I think that there's a lot we can do. First is make sure that you don't have an undiagnosed and treated sleep disorder, to dig a little deeper what your sleep issues are and really kind of customize a plan for you. And then after that, now, I mean, all of you are very aware, there's all these, what I call sleep luxury items out there. Like, do you need a chillo or a cooling blanket, or do you need a white noise machine? No, you probably don't need it, but could it help? Maybe, right? So there are a lot of things that I think people are being a little bit more open to, and we're certainly being more open to really kind of customize those recommendations.
And I'll say this too. I think we recognize that sleep behaviors and patterns. It's a phenotype. I mean, there. It's actually we know that's in your DNA what type of sleeper you are probably naturally going to be. There are things we can do to kind of help cement so that you can be the best at it. But things like your circadian window and your circadian pattern, some of that is somewhat fixed, and we try to adjust so that you can ideally socially feel like it's in line with what you want to do. So I think what I found with folks who may feel that they may be two-part sleepers is at least trying to minimize triggers in the environment that can make that even more concrete and be more distressing for a patient. So you're probably definitely want to minimize, again, artificial light and those sorts of things, because if anything, that's only going to potentially make matters worse in terms of disrupting your sleep. But I would say some of what we're learning is how we try to work with what a person's natural personality, sleep personality and phenotype is, and then trying to adjust things accordingly. We have a pillow question and mattress question, Rachel.
So, I mean, I think it's all about preference. And, we get questions like that all the time, especially from our patients. And there are certainly, even like what side of what positions should I sleep in? And it just, again, it like with everything else, it will depend. Like, what's your preference? Do you have chronic pain? Do you have a hip replacement? Like what are your strategies, and really just finding the support that you need so that it's comfortable. Some people get very hot when they sleep. So obviously, having silk and satin sheets, probably not a good idea. But maybe a cooling blanket or a chillos, one of these little pillows. They're like little mats you can put in the freezer and then pull them out, and then your pillow's like kind of cool. So there's just different strategies. I would say that, yeah, like, a lot of the mattress stores out there, they let you come and like test it out. And you can even do that with pillows. I am a big advocate for doing just that, because anything you can do in your sleep environment to enhance your sleep, even just by a little, I think can go a long way.
And one thing I'll add too is this is again about personalization and thinking about your other medical history, other things that can factor into your sleep quality. So I tend to tell folks if maybe they have allergies, they may have a history of asthma, that they probably want to stay away from like down pillows, for instance. Those typically can have more of a tendency to collect dust mites and things like that. So you may want to stay away from those. You may want to have more of those non-organic pillows if you are in that sort of camp. The other thing is, generally speaking, you want pillows that, and the other thing is that it can be washed. So again, for that purpose, things like a down, those sorts of, you can't do that. So those are some of the things you want to think about. A mattress that's comfortable and a mattress that you probably can change every 10 years is probably better than a really, really expensive mattress that was so expensive you can't imagine trying to chuck out that kind of change for another 20 years. Is probably still not the mattress for you. So that's the other thing, is balancing what financially is workable, what's comfortable, and probably sticking with the guidelines of about 7 to 10 years to change your mattress.
And the reason we say 7 years is because there hasn't been extensive, but there was, kind of a little study where they measure, or they weighed a mattress, and about 10 years it doubles in weight. So, and if you have pets and, multiple, either kids coming in, sleeping with you, the cats, and, then that's going to gain weight quicker. So, a mattress like a cover, bamboo type pillows, like those kind of things, like will extend the half-life. So there's just so much we could continue talking. We could have a whole session, and probably one of our podcasts will be about mattresses and then another one on pillows. But we got a few questions regarding like supplements, including Benadryl, CBD oil, and prescribed sleeping pills over the counter and not. So I'll take I'll take the Benadryl. We'll start there. So Benadryl is often a real quick go-to medication. I will say that for me, Benadryl is a big no-no for people over the age of 60. It can cause major issues with memory and cognition. So I don't like it. It can even exacerbate like people who have blood pressure issues. So you want to be very careful. But if you don't have medical issues like that and you're younger, and it kind of helps here and there, then it's probably fine. The issue is when you kind of get conditioned. You don't really get addicted to Benadryl, but what happens is your brain. I mean, we're not living in the 1500s, right? Like the sun came up, we weren't on the internet, we weren't watching our Netflix and all this stuff. So like our brain had natural cues of when bedtime comes. And now we're under all these artificial lights, the LED lighting. It's basically telling our brains that it's time to be awake, even though you might be really tired. So our environment has definitely shifted. So when you take things like Benadryl or anything, CBD oil, your brain's like, oh, well, that's part of my routine. If I don't get that, then I don't know it's time to sleep. I need that. And that's what even happens with prescription medications. You often see that a lot of the prescription medications, they don't add like significant amount of time. There's multiple studies showing that at most, maybe a couple minutes, but most of them are a couple seconds. So, and they do have a lot of side effects. Most of the prescribed medications have black box warnings. And I know some of you, I always say this, and granted, I'm not in clinic Monday, Tuesday, Wednesday, Thursday, Friday, because I'm academic. I wear other hats at Hopkins. But I don't prescribe sleeping pills that often. I mean, at this point, I probably now less than 30 times a year, I'll prescribe a prescription. And partly it's because people already tried stuff by the time they get to me and it didn't work. Or, patients, many of them are not interested in trying like medications that have a lot of potential side effects. So we're doing the more natural route. And for those of you that are concerned about insomnia, not being able to get to sleep or stay asleep, the number one treatment strategy for that is actually cognitive behavioral therapy for insomnia. That's what's been proven to work the best. So a lot of these medications aren't helpful. With that being said, we often will use melatonin not as a good sleeping pill, but as a circadian rhythm. Like it'll help anchor that. It'll help the timing of your sleep-wake schedule. But timing is so important, and that's why it's really, probably in your best interest, especially if this has become an issue for you, to probably come see a sleep specialist.
And I will just throw out too from nutritional supplements. There is some data about magnesium as a potential, more natural enhancer for sleep. Of course, and vitamins deficiency, they should be supplemented, but just taking vitamins without having any sort of baseline to know can also be toxic. So it's something that really should be done under the watchful eye of a doctor. One of our providers, Dr. Tracy Steer, who's our sleep anesthesiologist, is actually getting specialized training in integrative medicine so that she actually can be a touch point for us on this very issue, because we really think it's a very nice avenue to go down, but want to make sure we do it based on the science and the data. So so magnesium, vitamin B, folate, and as Dr. Salas mentioned, melatonin, in properly used, can potentially be of benefit. Someone mentioned about CBD. At this point, we do not recommend it or have got, just because we're really awaiting some sort of established guidelines. This is still very much the Wild West in terms of having studies that are using a standardized approach, using standardized formulations. And, we really kind of await getting more data on that to kind of provide any recommendations.
Just because we're up on time here, but I do want to say we had a question about if you don't live in Baltimore, can you be seen at the Johns Hopkins Center for Sleep? And the answer is most likely yes, especially right now with telemedicine, being more available. You should call our sleep center, and the generic real quick is 1-800-WE sleep. Okay. And you can find out if you can be seen by one of us in our sleep center. And we're sorry we're not able to answer all the questions for sleep, but this will be posted as well as several of our resources so that you can access some important information. And otherwise, maybe we'll see you at some point. All right. We'll see you.
Sweet dreams. Bye-bye. Thank you.